covering one of the most common reasons why couples seek sex therapy, and it is called sexual desire discrepancy. What this refers to is when one partner has a higher desire or a higher sex drive, and the other partner seemingly has a lower desire for sex or a low sex drive. Usually this creates some arguments, disagreements around how often the couple is having sex. One partner wants to have more sex, one partner seems to be avoiding sex or not as interested. Very common reason for couples to seek sex therapy. We're going to discuss what causes this very common problem in many couples, and also the common yet very bad advice they are often given in treating this particular struggle. Welcome to a Pleasure Program Quickie. My name is Holly.
I'm Victoria.
We are two licensed therapists specializing in sex therapy, and we are here to provide some sex education content here on YouTube, as well as answer your questions, and we even have a series where we react to Reddit posts regarding all things related to real people's sex lives. If all of this seems interesting to you or you'd like to join our community here on YouTube, please consider subscribing.
Information we are discussing today comes from the book Magnificent Sex. We have a whole nother video on it. Feel free to check it out. In this book, they discuss their research on what allows for people to have great sex. They discuss a common relationship dynamic that can develop which prevents great sex, something they call the relationship death spiral.
Sounds very serious, very
Yeah.
concerning. Something we all want to avoid.
Yes.
So the first sign of trouble when looking for the sexual relationship death spiral is when one partner is pushing for more sex and the other partner is settling for more sex, with that sex not being especially fulfilling for them. And what's interesting here is that we tend to think in heterosexual couples that the male partner is the higher sexual desire partner and that the female is the lower desire, but research suggests that this is pretty much split down the middle. This can happen either way, with either partner being seemingly higher sex drive and the other being lower.
And can happen in same-sex relationships.
Yes, and for queer couples this happens. What would cause someone to lose some interest or desire in sex in their life?
Let's get into a whole list of reasons because there's quite a lot that might be contributing to this.
And these are just a few.
Just a few, but there could be unresolved arguments. Maybe someone's holding resentment. One partner may have sexual fantasies that they have not shared yet, and they feel that their sex life does not resemble those fantasies. One partner is experiencing pain during sex. Of course, you're not going to want sex and you're going to have low desire if the experience is painful in an unwanted way, right? Maybe one or more partners are sleep deprived, right? There's transitions maybe with a new child or other transitions happening, or there could be a history of sexual abuse, which can make liking sex challenging sometimes, or there could be disabilities or diseases or medications getting in the way, causing low desire. We see that a lot. Or body image issues, dealing with death or grief, that getting in the way. Or misperceiving each other's cues due to a lack of good communication about sex, right? We often see people be like, well, I initiated. Okay, what did you do? I touched their leg. And the other person's like, that was initiation? On what planet?
There can be many very common, normal life circumstances or reasons that might impact somebody to feel less open to sex. Ideally, in a perfect world, what we would want a couple to do is to identify those barriers and collaborate and work together to try to resolve them if possible in order to create the space in their life to be open to sexual desire. Unfortunately, this is not what most couples do. And this is due to a couple of reasons. So even some sex therapists might give some poor advice to a couple on what to do here. The first thing to understand is something called desire types. There's spontaneous desire and there's responsive desire. We do have another video that fully explores these desire types in detail. We will link that below, but just as a quick summary, spontaneous desire is when somebody feels desire for sex in anticipation of pleasure, and they seem to be able to more easily feel desire. Maybe just thinking about sex can help them get into the mood. It's one of the most commonly depicted desire types culturally. We tend to associate this desire type with men, although men and women can experience this desire type. Responsive desire is when somebody feels desire in response to pleasure. So something pleasurable needs to be happening for them first, and then they start to feel the desire kind of kick in.
This doesn't have to mean sexual pleasure, just to clarify. It could be a pleasurable state of mind or environment or something like that.
Very often the context goes far beyond just genitalia or sex. It's a pleasurable state. The bad advice that can be given is if the lower desire partner is assumed to have a responsive desire type, then they should just do it. Just have sex and wait for that desire to kick in, and it's just going to happen. You just need to respond to the pleasure first. And this might be coming from a sex therapist. It might be coming from articles or books that one or both partners are reading, or maybe a podcast or something where, oh, I'm a responsive desire type. I should probably just do it. Just kind of push myself to do it, and then I'll feel desire. And so what happens, as mentioned earlier, one partner is pushing for more sex, the other one is sort of settling for the sex without there being desire there. And what can happen, and often does happen, is some desire, some arousal might kick in during that sexual encounter, but it's still pretty poor quality. There's still a lot of missing pieces that that person really does require in order to have a good quality sexual experience. Couples make the decision to go ahead, proceed to have sex despite the lack of desire with the best of intentions, often because they have a strong commitment to the relationship and they don't want their sex life to just die. So it's a very understandable step to take, although it's a dangerous one. This is where the sexual relationship death spiral begins. How do you think this dynamic evolves, Victoria, over time?
If this dynamic becomes habitual, the lower desire partner will begin to feel resentful or have sex out of guilt or dread future sexual encounters. And the higher desire partner may not notice the lack of engagement or enthusiasm at first and be pleased to be having more sex, and eventually it will become impossible to not notice the lack of quality in the sex. The higher desire partner often initiates the sex, but the lower desire partner will try to speed things along to end the sex as soon as possible, cutting foreplay short, racing to the finish line of orgasm, which just further reduces the quality of sex.
Something I do want to mention, that if in general you and your partner have a pretty high quality sex life, and you on occasion do settle for sex where maybe your desire wasn't really there, but you do it more so as a favor to your partner, research does indicate that as long as you're not doing that more than 15% of the time, it really doesn't do any harm to your relationship. So just know that going in, but the real threat to your relationship is when this becomes habitual and a pattern.
And if this sounds familiar to you, you're not alone. This is a common downward spiral that many couples face.
If someone is faced with this sexual relationship death spiral, what can they do about it?
We first need to start by shifting the dynamic from dread around sex to anticipation for sex. And we do this by refocusing from quantity to quality. In Emily Nagowski's book Come Together, which focuses on sustaining sexual satisfaction in long-term relationships, she discusses how having a responsive desire type is linked with long-term sexual satisfaction, which is great news. This is because having a more responsive desire type requires more planning and creativity, communication, and collaboration to have fulfilling sex, all of which are qualities present in high quality sexual relationships, which makes sense, right? Like if you're planning your sexual encounter and you're trying to be creative and have novelty to it, or excitement or romance, and you're prepping everything, right? Like you're having lubrication ready or toys ready or the environment ready, cutting out your distractions, right? You're way more likely to have high quality sex than if you're just engaging in it out of guilt or to please someone.
Which is way sexier than just doing it. If you'd like to learn more about how to increase the quality of your sex life, please check out our video about your best sex life, and we cover all of the main points from the book Magnificent Sex. You won't regret it. Thank you for watching. We would love to hear from you. Please leave a comment below. Let us know if there's any other topics you'd enjoy us to cover here on the Pleasure Program. Consider subscribing, and we will see you again soon. And the other partner seemingly has...
I was trying so hard.